Hey, Dr. Sean Neighbors here, licensed mental health therapist, West Michigan anxiety specialist, and owner of the Anxiety Treatment Center of West Michigan. Hey, I would like to talk to you today about two primary approaches that the mental health field uses to address anxiety disorders. Now, there are a lot of different therapies and medication approaches to address anxiety, but those all fall under two primary approaches or methods that the field uses when approaching anxiety. Now, these two approaches are symptom based interventions and what I like to call adaptation based interventions. Let's first talk about symptom based interventions. Those are any therapy approach or medication approach that are designed to help someone to control or manage how intense their symptoms get. Adaptation based interventions are any therapy approach, not necessarily a medication approach, but any therapy approach that helps someone to develop skills to better deal with the anxiety. So, less on managing symptoms and more on dealing with it in a way where you begin to adapt to it and really increase your tolerance for the anxiety. Now, symptom based interventions are excellent for acute issues. These are for people who developed a anxiety issue out of nowhere that's causing them lots of distress. The anxiety is really high, it's impairing their functioning, and they really need to manage those symptoms pretty quickly to restore functioning. Now, symptom based interventions fall short long term because what they do is they develop a dependency on needing your symptoms controlled. So, if you always need your symptoms controlled, without that controller in place, you really don't have a hold over your anxiety issue. Now, adaptation based treatment approaches are great for chronic issues. For people who have dealt with anxiety for a very long time and they do not have an effective way to manage that chronic anxiety, adaptation based approaches are great because they give them skills to be able to deal with that anxiety better so that it's no longer a chronic problem. And that typically looks like helping them to maybe stop avoiding it so much and learn skills about how to lean into it more, which will increase quality of life. Now, adaptation based approaches are not good for acute issues. For people who their functioning is greatly impaired and they need some resolution over those symptoms immediately, an adaptation approach is just simply too long. So those are the the different ways that the mental health field addresses anxiety issues: symptom-based interventions and adaptation-based interventions. Hey, thank you for stopping by and happy holidays.